Hi everyone, I'm Karen and I'm one of the nurses in cardiac rehab. So, in this presentation, we're going to talk about the importance of exercise within the context of cardiac rehabilitation. We'll discover how tailored exercises can empower patients on the road to recovery, improving not only their physical health but also their overall quality of life. So, our aim today is to provide you with some understanding of the benefits and best practices associated with home based exercise programs to help improve strength, flexibility, and endurance, especially for cardiac rehab patients. So, these are the contents of the presentation. We're going to talk about the benefits of exercise, adaptation, progression, regression, how to create your own program, the fitness components, fit principle, which includes the frequency, intensity, time, type, and enjoyment, and ways to maximize your success. So, what benefits do we get from exercising? Exercise offers a wide range of physical, mental, and emotional benefits. And here are some of the key advantages of incorporating regular exercise into your lifestyle. Number one is enhanced muscle strength and endurance. Remember, exercise, they help build and tone muscles so that can improve overall strength and endurance, which can make everyday tasks easier. It also helps improve cardiovascular health. Exercise strengthens the heart, improves blood circulation, and helps lower the blood pressure, thus reducing the risk of heart disease and stroke. Exercise can also help with weight management. Regular physical activity helps burn calories, making it easier to manage and maintain a healthy weight. It can also help with bone health. Weight bearing exercises like walking and resistance training, they can help maintain bone density and strengthen bone composition. And this can also reduce the risk of osteoporosis. Also, I want to point out stretching and flexibility exercises, they help enhance joint mobility and balance, and that can help reduce the risk of falls and injuries, especially as you age. Like we said, there are also mental health benefits as well. Exercise stimulates the release of endorphins, which can reduce stress, anxiety, and depression. In turn, it can help improve someone's self-esteem and confidence. Exercise also help improve cognitive function and memory. And exercise is also beneficial for managing chronic conditions such as diabetes. Exercise adaptation describes the physiological changes that occur in the body in response to regular and consistent exercise. One of the most important physiological adaptations that result from regular exercise is an increase in cardiorespiratory capacity. Note that adaptation is a gradual process that occurs over time. So, to achieve this, we have to work past the threshold, and that can sometimes take weeks and months of consistent training. So, exercise progression. This allows for improvement in physiological capacity by systematically increasing the intensity or the workload, duration, frequency, or complexity of exercises over time. This method will allow us to challenge and improve our overall fitness level, strength, flexibility, and endurance. So let's say someone who enjoys running marathons or biking suffers a leg injury, and that leg injury could be a sprain or a fracture from a fall. Now, because of that fracture, this person cannot bear weight on that broken leg for weeks or even months. So, situations like this can happen, and once this person recovers from their leg injury, they won't be immediately running another race or another marathon. Like this example, sometimes we need to scale back and reduce our intensity or workload, or even our exercise duration. And this is what we call regression. And there are many other influencing factors that can lead to this regression. Other factors include illnesses, could be busy schedules for those of us that are working full time, And it could also be constant traveling, especially during the holidays. So now we're going to talk about ways to create your own program. Now, creating your own exercise program, it needs to be tailored to your own fitness goals and preferences. Remember that handout I gave you about SMART goals? And if you haven't received that handout in class, I strongly encourage you to ask one of the staff members for one of those handouts. And when you create your exercise program, always think of the SMART goals. Now, what are the SMART goals I'm talking about? SMART goals, or SMART, that is an acronym. We basically want you to make your goals number one, S for specific. So you want to set clear and well-defined goals. For example, your goal can be maybe increase muscle tone, could be weight loss, or it could be maybe increase your speed in the treadmill. Number two, measurable. Number three, we also want your goals to be achievable. Make sure that you can reasonably accomplish your goal within a certain time frame. So that time frame can be weeks or months. Number four, we also want your goal to be relevant. So your goal should align with your values and what is important to you. And lastly, your goal has to be time bound. You want to set a realistic end date to prioritize certain tasks. So all of these elements of the SMART goals, remember, S for specific, M for measurable, A for achievable, R for relevant, and T for time bound. All of those elements are needed to provide clear direction of your home exercise program. So fitness is a multidimensional concept. It covers various components that contribute to overall physical well being and ability to perform daily activities. Some of the major components of fitness that I would like to address include number one, muscle strength and endurance. Number two is the cardiorespiratory fitness and cardiovascular endurance. And that refers to the ability of the heart, the lungs, and the circulatory system to deliver oxygen and nutrients to working muscles during physical activity. Also, flexibility refers to range of motion of a joint or a group of joints, and flexibility is essential for mobility. And in the next few slides, we're going to talk about the different components that make up the FIT principle. So, what is the FIT principle? It's an acronym that stands for frequency, intensity, time, type, and enjoyment. Each of those components, they represent a key aspect of designing a well-rounded and goal-oriented exercise routine. Thus, understanding the different components can actually help you formulate a plan that's sustainable and can help you achieve your goals. So, first, we're going to start with frequency. Frequency, how often should you exercise? Now, the general recommendation from the CDC is to do at least 150 minutes of moderate aerobic exercise per week. Now, we know that 150 minutes of physical activity each week sounds like a lot, but you don't have to do it all at once. It could be 30 minutes a day, 5 days a week. And you can also further break this down and exercise for 6 days a week instead. And there are also multiple ways that we can measure intensity. And we will talk more about each of these methods in the next few slides. But the second component of that FIT principle is intensity. So the question is, how hard should you be working? So to briefly go over some of the methods to measure intensity, first we have the rating of perceived exertion. We also call it the Borg scale. Second, we can also use something called a talk test, and that's to see how hard we are working. We can also use or look at the METs, or the metabolic equivalent of tasks. And lastly, we can also measure our exercise intensity using our exercise target heart rate. And that heart rate, that number depends on a person's age. So you might see us come around while you're on a machine. You can be on the new step or on the treadmill, and sometimes we will ask you how hard you feel like your body's working. When we do this, we are assessing your score on the Borg scale from very light or extremely hard. This is the rating of perceived exertion, or the RPE, and that is our way of measuring your physical activity intensity level. Now, there is a photo of this Borg scale on the back page of the exercise handout that I provided during class. And again, if you need one of those handouts, please don't hesitate to ask one of the staff members. So, as an example, someone who wants to engage in a moderate intensity for this physical activity would aim for a Borg scale level of somewhat hard, and that number tends to fall between 12 to 14 on a 6 to 20 scale. Intensity can also be progressed to 70% of the heart rate reserve, or HRR, and that number also represents about 14 on the Borg rating of perceived exertion scale. So another way to measure relative intensity is something called a talk test. So in general, if you're doing moderate intensity physical activity, you can talk, but most likely you cannot sing during this activity. However, if you're doing something very vigorous, you're not going to be able to say more than a few words without pausing for a breath. And we don't want you to be short of breath or gasping for air during your exercises. Our goal is that 12 to 14 Borg scale, remember? So you should still be able to talk during your exercises as we aim for that moderate intensity exercise. You may have also heard of us talk about METs before during one of the exercise classes. But just to recap, what are METs? And when we say METs, we're not referring to the baseball team. Instead, we are referring to the measure that is used to express the energy expenditure, or the metabolic rate, that is associated with various physical activities. And I'm going to show you some examples of these activities in a different slide. But remember that when we say METs, we're not talking about the baseball team, okay? So METs, or metabolic equivalent of tasks, they help us measure how much energy or oxygen is being used during the different activities. And our baseline, we have one MET, and that represents the amount of energy expended while you're at rest and just sitting quietly. And remember that the higher the energy expenditure, the higher the MET's number. The MET value of a physical activity indicates how intense it is in relation to resting. So, like we said earlier, the higher the MET's number, the more intense the physical activity is. Now, this slide shows you some examples of the different activities and their corresponding MET's number. So, on the top left picture, for example, you can see that carpet cleaning or vacuuming is equivalent to about 3.3 METs, while moving furniture is equivalent to about 6 METs. And in the bottom right photo, we have on the green side over there, we have salsa and swing dancing, and that's equivalent to about 4.5 METs. However, you see that on the right side, on the blue side, you see that boxing and or sparring, it's equivalent to about 7.8 METs, and beach volleyball is about 8.0 METs. So the higher the intensity, the higher the METs number. So now we're going to move on to the other component of the FIT principle, and that is time. So time refers to the duration or length of each exercise session. Our goal is between 30 to 60 minutes of exercise. And remember that this does not include your warm up nor the cool down. And depending on where you are on your fitness level, you can break this exercise time into 10 or even 15-minute intervals. And you can also modify your routine and slowly increase your duration, maybe by that 5 or 10-minute intervals at a time. So the second T in that FIT principle is type. And type refers to the specific type or mode of exercise that you choose. And our goal is to perform aerobic exercises. Now, what are these exercises? Aerobic exercise is a physical activity that uses your body's large muscle groups and is rhythmic and repetitive. These exercises increase your heart rate and how much oxygen your body uses. And I'll give you some examples on the next slide. So, these are some examples of aerobic exercises. So, that includes brisk walking, could be rowing, cycling, swimming, for those that like the water, could be hiking, skating, skiing, and dancing. And enjoyment is the last component of the FIT principle. Remember that the type of exercise that you should align with your goals and preferences. Um, Also, make sure that these activities you that you choose, make sure that these are the activities that you enjoy, and that can help you increase your adherence to the fitness program. Remember that choosing activities that you find enjoyable and fulfilling, they can make it easier to stay motivated and be consistent with your workouts. You can also try new things, and you never know, you might be surprised by what you enjoy. So, lastly, these are some tips to help you maximize success in achieving your goals. Remember, like we said earlier, prioritize your enjoyment. You can also keep a record or a journal to monitor your progress. Sometimes it's also helpful to find a workout buddy. You can have that other person to help you stay motivated in your exercises. Remember your SMART goals. You want to be goal oriented. You want to try to find your short, medium, and long term goals. You also want to aim for progress, and you want to do that progress systematically and gradually. And lastly, also make sure you plan for some obstacles. Could be work related, vacation, holidays, or it could even be weather related. And that is the end of my presentation. Thank you so much for listening. These are the references for this presentation. And please don't hesitate to ask or approach any one of the cardiac rehab staff members if you have any questions. Thank you so much and have a wonderful day.